Our last speaker for today is Associate Professor Pecoraro. Associate Professor Pecoraro is an obstetrician and gynaecologist and an experienced leader in medical organisations and the medico-political sphere. He is the president of the National Association of Specialist Obstetricians and Gynaecologists, NASOG, as well as the federal chair of the AMA. He sat on many state and federal government panels and committees providing women's health expertise and experience in helping improve health services for the women of Australia. As a fellow of RANZCOG, he has also had a long history of roles within the college, and his contribution to RANZCOG has been recognised with the awarding of a Distinguished Services Medal in 2016. He works in Brisbane in public and private practice. We'd like to thank NASOG for supporting PVOGS and our webinar today. The National Association of Specialist Obstetricians and Gynaecologists is a not-for-profit professional association providing advocacy for Australian specialist obstetricians and gynaecologists. And Associate Professor Pecoraro will discuss today their role and the importance of maintaining accessible and affordable private O&G services in Australia. Thank you.
All right, thank you very much. First of all, I'd like to say thank you very much to the organising committee for inviting me to be part of your conference today. We really value the ability to speak to you and make contact with you. I want to specifically thank one of the previous speakers, Merv, whose story really touched me. And I think it's something that is central to everything that we need to talk about, and that is to make sure that we look after ourselves. If we can start with the members of your organisation, I have to declare, well, not really a conflict, but an interest. I've got a daughter who's a final year medical student who's looking at becoming an O&G. That's what she wants to do with her career, and she's already a member of your organisation. She speaks very fondly of it, so I think that's a good thing. It's a very important thing that you realise what strengths you have, and I just want to pay you a little bit of a compliment at the moment. Anybody who's involved with your organisation is already ahead of the curve when we speak to other medical graduates and indeed medical students. You've got an idea of what you want and you're being proactive. You're going out and looking to achieve your career and what you want to achieve out of your life. And what we speak about when we give talks to young obstetricians and gynecologists and people hoping to get into the training program is we want you to be the driver of your career, not external agents. We want you to be in control. We want you to take an active interest, and hopefully we can help you do that. When you talk about having a career as a medical doctor, when you're young, it's all about that important, I must get on the training program. Once I'm on the training program, I need to make sure that I can learn as much as I can about the area of medicine that I've chosen to work in. I need to make sure that I can get that all-elusive gynecological operating. If I can't do a TLH by myself by 5th year, I'm going to be in trouble. I'm going to struggle. And to be fair, I think we do quite well, or as well as we can, COVID-19 notwithstanding, in helping people to achieve all of those career aims. I think we're very good at teaching you, and the college is absolutely central in providing the education that you need. That's taken care of. What perhaps I think young gynecologists and obstetricians need to have is more beyond that. And I want you to start thinking about that even before you become a specialist obstetrician. What are you going to do with your RANZCOG? Why did you become an obstetrician and gynecologist? And certainly it's because you're interested, but you also wanted to have a career in that area. And that's very important. Because in Australia at the moment, we know that around 60–70% of people, once they finish their training, will need to work in the private sector. And increasingly, during your training years, your exposure to the private sector is less and less. A lot of states, mine in Queensland, where I'm from, although I'm in Armidale today, that's why I'm wearing 2 jumpers, because it's freezing, 27 degrees when I left Brisbane, coming down to 5 degrees when I got out of the car, but you know, that's life. You need to make sure that you've got something to work towards. There's nothing wrong with making sure that you have a satisfying career, and that means having availability to access work, properly remunerated work, where your rights are respected and looked after. We want you to enjoy working in your chosen area, delivering the healthcare to the patients that you look after. And obstetricians are a wonderful, wonderful group. We're very resilient, we survive, we're the canary in the mines for a lot of things in the political sphere. Remember, we were the ones who started evidence-based medicine. All right, remember that. Effective care in pregnancy and childbirth, it was called. And it was the Cochrane Review, and it started in obstetrics. And from little things, great things grow. And it moved to the rest of medicine. But then they caught up with us. We have to be flexible. The way that I practice now is not like it was when I first left. And you need to make sure that you've got access to the information of what's happening in the world. And if I could get the next slide up, that's where we believe that an organisation like NASOG can help you. And why we're going to ask that you, if you're not already a member, that you consider becoming a member so that you can help strengthen the voice that we have when we speak in various fora about the specialty of obstetrics and gynaecologists, and about women's health generally. We're in a situation in Australia where for generations, women's health has been undervalued by governments, both state and federal, for a long time. The investment, the financial investment, getting into the nitty-gritty about dollars and cents, which is what my task is to talk to you about today, has been desperately underfunded, and things aren't getting better. In fact, if anything, they could potentially be getting worse. And everybody has to accept and acknowledge that a post-COVID-19 world, even in medicine, will be completely different to a pre-COVID-19 world. How the health system works in Australia and how it meets the ongoing challenge of providing care to our women and families will be forever changed. Greater than 70% of elective surgery in Australia occurs in the private sector. Greater than 70%. That's very confronting, and it's important because post-COVID, that's going to change. The number of women in our community who have private health insurance will probably decrease, although there's some modelling suggesting that it may increase as people see value in it and as public waiting lists for elective procedures start to increase. But also what the women of Australia and their families will expect from accessing private care will also change. And we need to be in a position where we can meet the expectations of the community, our patients, and at the same time, make sure that we've actually got a job so that we can look after ourselves, practice our mindfulness, make sure that, as Vijay said, that we don't forget to allow time to speak with our families, make sure that we're looking after ourselves. Part of that is taking away some of the anxiety or stress that comes with not knowing if you're self-employed when you're going to be able to afford to take some time off work and have a holiday. And so for that reason, we think it's very important that you know what we do, because our primary role is to look after the doctors in obstetrics and gynaecology, because most of where we can have influence occurs in the private sector. We spend a lot of time looking after the roles of doctors and making sure that their patients have access to the opportunity, to the choice, for their choice as to whether they want to access private care, by making sure that we keep in constant communication with governing bodies, with funding bodies, and that means federal governments as well as state governments and private health insurance providers, to make sure that that option of accessing private care continues to be present and is available and is an ongoing choice for women around Australia. So even though it seems like a long way off, you need to start thinking about what you want to do in your career. What are your interests? Do you want to be a urogynecologist? Do you want to become a subspecialist with a really, really in-depth knowledge in one particular area? If you do want to do that, what will the environment be like that you're going to work in? We're certainly not all the way through the mesh fiasco. There is potential that there will be other situations like mesh that will garner a lot of negative press about our particular profession, and we need to have advocates who are speaking in the public arena with the opinion makers and with the legislation makers to make sure that people understand the role, the viewpoint of the doctors in this area. I'm coming close to finishing, and I want to end on a good note. I want to end again where I started. And that's, you're already halfway there. I think you're a wonderful group because you've thought about your future. You're engaged in what you're doing already. You can move to the next slide. I'm sorry, I was speaking without the slides, but they're available to everybody for information. But don't lose that positivity. The only certainty in the world is change and ongoing change. The future may be different totally. Well, almost certainly it will be change from what it is now, but whether it's a slight change or major change remains to be seen. You need to become involved in your profession. And that means becoming involved in professional organisations like ours, like college, like AMA, like societies like the International Continence Society, like the Ultrasound Society, like the Fertility Society. You need to find your tribe. You need to find people who feel and think like you, who are involved in areas like you, and who can support you, both at the local level, so that you've got someone to speak to when things may not be going well, or someone to share a social interaction with when things are going well, but also at another level to represent your views, to make sure that people understand why you are saying a particular thing needs or needs not to occur. And that means experience dealing with government and legislation bodies and those sorts of things. So you're in the right place. Be active, continue to stay positive, look to figure out the right way to practice for you. There's no right or wrong way, there's just what works for you. And above all, remember that if you're going to survive, certainly in the world of private business, you need to be flexible. You need to keep your wits around you, know what's going on, and which direction things will go so you will survive. If I could just put a plug out, you don't have to be a finished obstetrician and gynaecologist. We're very happy and we offer advantages for student and trainee memberships as well. We put out weekly blogs and information sheets and provide links to other organisations that can give you information. I'm very happy to answer any questions. I've tried to go as fast as I can because I know we're running a bit behind time.
Thank you very much. We've actually had a number of questions come through. The first is, what is the role of institutions such as NASOG in the advocacy for appropriate COVID-19 response in the healthcare system?
Our advocacy role in this is to make sure that we are absolutely up to date with what's happening around the country. Now, the reason for that is that this has become not just a health issue, but it is actually a political issue. A lot of the bad press that our federal government, our Prime Minister and our federal health leaders got were around whether they didn't work fast enough or how they rolled out the isolation. I can tell you from my involvement with government behind the scenes is that everybody knew what the right scientific thing was. It was how to deliver that information to the population of Australia in a manner that was able to be introduced, was safe to do, and that didn't cause mass hysteria or panic. And that's very important. So having inroads into people who make legislation and make decisions is important. Absolutely, you need to have the science, but running a country or running a health service is frequently more involved than just that. The other big thing that NASOG is doing at the moment is that we're very heavily involved with the post-COVID-19 planning, and we're having meetings with a number of organisations, including health funds, including state government health departments and federal health departments, on what the world will look like post-COVID-19. How will we deal with that backlog of elective surgery, which will happen in the public sector, which has been, in some sources, they're saying waiting lists may blow out to 2 years. Now, state governments were very quick to say, well, that's okay, we'll commandeer some of the capacity that's in the private sector and we'll move public hospital patients to the private sector. But the problem is that public hospitals are under the domain of state governments. State governments don't always agree with the federal government. They certainly don't talk to each other. And if they're a different colour politically from the federal government, they will have to make a way that they get political mileage out of it. That sounds terrible, but it's political life. And if you notice the states that are most vocal, they're usually the ones Victoria, Queensland, that are not necessarily blue in colour, but red in colour. And so that is important. That's why we tell you that if you're going to get involved with those sorts of things, you need to know exactly what you're signing up for. So find out what the legislation is in your state, find out what your protections are legally as a person who's providing healthcare, or as a junior doctor who may be conscripted, or even medical students. They're talking about getting medical students to go and work in COVID-19 areas. We need to make sure that you've got enough personal protective equipment, that sort of thing. So at the moment, what we're mostly working on is the post-COVID environment and how to make sure that the women of Australia can continue to access top quality services in obstetrics and gynaecology, and that the people who provide those services are looked after and valued and able to keep the doors open. Because certainly if you're a self-employed private practitioner, your overheads are fixed and enormous. I hope that helped.
And yeah, that was great. Thank you. We've got another question. How did you find yourself in the medico-political sphere, and what was your journey to?
Anybody who knows me knows that I just can't keep my nose out of things that are going on. I'm a sort of social people. People trust me, they talk to me, they tell me things. So frequently I would know of things that were happening at a hospital or state level before it was public knowledge. And I wanted to be involved. And so the first place I got involved was all at once. I got involved into college. I became an examiner. I took students. I became a counsellor. I got onto the board. I chaired most of the committees. I also at the same time joined my local AMA, Australian Medical Association, for a more political sort of bent. During that area, I learned a lot about how the political system works, how lobbying works, how you can achieve things both in the public sphere, but sometimes perhaps more importantly, in behind the scenes lobbying, how to effectively speak to people, how to hopefully get other people enthused, do some media training anywhere you can get it if you're interested in this sort of area. I write articles for newspapers, magazines, blog sites. I present sometimes on breakfast television and radio. Get involved. You're only limited by your own imagination. And I think that's something, again, that this group has, that you're already engaged, you're already doing something. Don't waste that wonderful enthusiasm. Use it for good.
Absolutely. And I think your journey has shown that there's more to medicine than just medicine, and there's plenty of different domains that we can work into the future. Thank you very much for your time today.
My pleasure.
That